Do you or a family member have diabetes? Is this a new diagnosis and you're feeling lost in knowing what changes you need to make in your life? Or are you just sick of taking medications and want to know what you can do to try and get rid of them? If so, then this video is for you. Keep watching because we're going to go over the most important steps that you need to start doing today to beat this deadly disease. Hi, I'm Dr. Eric Richardson, a board-certified family practice physician. I'd like to welcome you to Family Med, a channel that focuses on giving you practical and accurate medical information to help you and your family. If you think this will be something that's helpful to you, make sure you subscribe, hit that notification button, and follow along with us. This is the third video in our series on diabetes. In our last video, we discussed all the reasons that you need to be taking diabetes serious and how it can impact your health and life. In today's video, though, we're going to start talking about the ways that you can take charge of this disease and not allow it to control you and avoid all those complications that we discussed before. Now, we're principally going to be focusing our discussion for those who have type 2 diabetes. Certainly the principles that we'll be discussing apply to those with type 1, but it's always good to review any changes of your treatment with your own doctor. And when we talk about how to treat type 2 diabetes, it's important to remember and review what is happening in the disease. The main problem that happens in type 2 diabetes is your body becomes resistant to insulin. Insulin is a hormone that's produced by your pancreas that helps bring glucose from the blood into the different cells in the body to use it as fuel. In a normal body, you eat a carbohydrate. Your body digests it and turns it into glucose, which is then absorbed into the bloodstream. Your body then senses that blood sugars elevate and releases insulin to bring that down. Now, that same process is happening in diabetes. However, your body's become resistant to the effects of insulin. You're still producing it, but it just doesn't work as well. Our treatments then are going to center around overcoming this insulin resistance. We have a lot of tools that we use to treat diabetes, and oftentimes medication is one of those tools. However, in this video, we're not going to focus on that because we want you to start focusing on the things that you can change that are going to make the biggest long-term difference. Medication is often necessary, but most people, if they would just take serious the things that we're going to talk about today, can either avoid or minimize how much that they would need to take. So let's talk about how you can start doing that. The first thing that you need to start to incorporate in your life is exercise. Exercise has been shown to play a significant role in being able to help control diabetes. It does this for a few reasons, the most important of which, of course, is helpful in losing weight. Fat cells play an important role in contributing to you being insulin resistant. So the more that we can work on decreasing your weight, we're going to see some improvement. Now, exercise itself also has a significant impact on how your body is able to utilize insulin. The mere act of exercising can decrease your body's insulin resistance, and that effect can last most of the day. Most studies have shown that exercising about 150 minutes a week or 30 minutes a day, at least 5 days a week, play a huge role in being able to control your diabetes. And it doesn't have to be an extremely vigorous routine either. A good brisk walk for many can be sufficient. So get out and get started on a good walk every day and see what kind of difference it can make. I will warn you though, if you have not been very active, before you do more than a walk for exercises, it's always good to visit with your doctor and get a good physical before undertaking anything strenuous. So the next step you need to start focusing on is your diet. This is probably the hardest one because it's going to require changing habits that you've been living with probably most of your life. This is going to be the most important thing though you can do because for most, it's probably one of the main reasons that you've developed diabetes. But the good news is that by taking this part serious and making some good changes, you can oftentimes avoid having to take a lot of medications or maybe none at all. When we talk about what to eat, we need to remember one of the big reasons we're in this mess, and that's the insulin resistance that you have. As we pick our foods, we need to avoid those things that are going to cause a rapid rise in your blood sugar. Now, the most obvious culprits with this are going to be your food, drinks, and desserts that are full of sugar. Now, this is white sugar, brown sugar, corn sugar, syrups, and on and on. These types of sweeteners take little to no time for your body to digest and are quickly converted to glucose, raising your blood sugars. They're probably the worst for you, but also the most obvious, so hopefully you've already started to think about getting rid of these. After reviewing this, one of the most common questions I get is whether they can have artificial sweeteners like saccharin or aspartame. The short answer is no. They really aren't okay. This is a longer discussion that we won't get into today, but your artificial sugars through other means will still raise your blood sugar and have been shown to contribute to weight gain. So if you're going to reach for sweetener, focus on sweeteners such as stevia, monk fruit, coconut palm sugar, date sugar, and sugar alcohol such as erythritol or xylitol. They do tend to be a little bit better option. So the next tier of foods that you need to start to avoid are the refined carbohydrates. These are foods that are principally made up of white flour or white rice. These are going to be your breads, your pasta, and other baked goods and cereals that are a common part of your Western diet. The reason why white flour and rice are a problem is because they strip all the fiber and other nutrients from the kernels, just leaving that little white pulp. This is a pure carbohydrate that is digested and absorbed just as if it was sugar. It causes a rapid rise in your blood sugar and makes it difficult for your body to deal with it. So foods you want to stay away from are going to be your white breads, bagels, muffins, pastas, tortillas, cereals, white rice, pretzels, and crackers. Really anything with white flour or added sugars you need to avoid. Instead, reach for whole grain versions of these things. But even with whole grains, you still need to keep your portions lower because they still can affect your sugars. Other foods that can cause you problems are things like potatoes, corn, sweetened yogurt, and beer. Now what about fruit? Well, fruit in and of itself is very healthy, but you do need to be cautious because it still can increase your blood sugars. If you're going to have some, keep it in moderation and make sure you eat the whole fruit and not just the juice. But out of all of them, berries, they tend to be the types of fruit that will affect your sugars the least. Now remember, keep things in moderation and monitor how it affects your sugars. In the end though, I would still rather you reach for an apple to satisfy that sweet tooth than a candy bar. Now, we've gone over a lot of the foods that you shouldn't be eating, but it's important to know that there are a lot of good foods out there that are going to be able to eat and a lot of fantastic recipes out there that you're going to love. When you go looking for what is good for you to have, focus on recipes that are full of vegetables, legumes such as beans and peas, whole grains, nuts, healthy lean sources of protein like fish, chicken, and lean cuts of meat. Reach for good sources of fat like avocados, canola, and olive oils. With all these foods, you can really make some delicious meals. A good easy approach to use is what we call the plate method. The American Diabetic Association recommends filling half of your plate with non-starchy vegetables such as spinach, carrots, broccoli, or tomatoes. A quarter of your plate should have proteins like tuna, lean pork, or chicken. And the last quarter, unless you're really trying to go very low carb, you can fill with a whole grain items such as brown rice or starchy vegetables like green peas. Throwing in good fats like your nuts and avocados as part of that can also make for a delicious meal. It's important that as you decide on what you'll be eating in the day, to monitor how many carbohydrates you're eating. There are varying recommendations out there for how many carbohydrates you should be eating as a diabetic. A good goal, if you're really trying to take control and to minimize how many medications you would need to take, is to keep your diet under 100 grams of carbohydrates a day. If you want to have a bigger impact, try to reach for around 50 a day. That isn't very many. Studies have shown that keeping your carb intake to at least 20% of your diet has been linked to better weight loss, fewer medications, and ultimately better control of your diabetes. I would suggest visiting with your doctor or nutritionist on what they would recommend for you. Well, we focus most of our time so far on diet because frankly, that's the most important of all of this. Beyond that though, there are some other important things that you should focus on. One that we don't really talk about but is really important is managing your stress. One of the body's reactions to stress is to tell your liver to release more sugar. So, focusing on ways to eliminate stress from your life and finding appropriate ways to relax are going to be really important in treating this. Now, the final recommendation is quite obvious, but if you smoke, it's time to stop. Adding smoking to diabetes is going to dramatically increase your risk for developing all the complications that come with diabetes. Now is the time to make the commitment to get away from them. If you're struggling to do so, then talk with your doctor on options that they can help you with. It may feel overwhelming thinking of all the things that you need to change to take charge of your health again. And to be fair, it is. You need to sit back though, take a deep breath, and realize that you don't need to do this alone. Work with your doctor, a good nutritionist, your family, friends, or even in online support groups. There's a lot of support and help out there. Now, there are a lot of medications out there that we can and may have to use along the way, but frankly, most of them are expensive. The more you can do in implementing these changes in your life and making them more permanent, the better off you're going to do. You're going to feel better, look better, and you'll gain new confidence that you can take charge of your health and beat this disease that is working really hard in beating you. I know you can do it, so don't give up. Okay, so that's a brief overview of the changes that you need to focus on to control this. Hopefully you've been learning a lot though through this series on diabetes. In upcoming videos, we're going to be discussing some of the important things that you need to be doing with your doctor to prevent or catch early any of the complications that can come because of it. As well, we're going to be talking about some of the common medications that can be used that maybe if you need some extra help. Now, so you don't miss out on these, make sure you hit that subscribe and notification buttons right now. When I get them done, I'll put the links to these on the side so you can learn more about beating this disease. Well, that's all we have today, so thanks for joining us here at Family Med, and we'll see you in the next video.